I would like to begin by acknowledging the traditional custodians of the land of which we meet and pay my respects to elders past and present. My name is Rebecca Cattermole and I'm the Chief Executive Officer of St John of God Accord. We are a not-for-profit, for-purpose disability provider in Victoria. Accord is also a proud member of Catholic Health Australia and shares CHA's commitment to delivering high-quality, compassionate services that enable vulnerable people to live full and valued lives. I have worked in the disability sector for almost 20 years and I've seen significant reforms, including the introduction and evolution of the NDIS. We support the broad direction of these reforms. My focus today is how it can be implemented effectively, safely and sustainably. So there are 4 key messages that I'd like to share with the committee. My first message is that the reform is necessary, but implementation and sequencing matters. Replacement services must be funded, operational and accessible before existing supports are withdrawn. In our sector, unmet need rarely disappears. More often, it shifts to families, the health system, or forces providers into delivering unfunded supports. The risk is amplified by the cumulative impact of the scale and complexity of these reforms. Providers, participants and families are navigating simultaneous changes to service models, legislation, access, pricing, workforce, technology and compliance. Any one of these changes might be manageable. However, combined, it draws resources away from frontline services, places pressure on families and risks driving quality providers away from the market. My second point is that the legislation must work for people with complex circumstances, not just those whose needs fit neatly into an automated assessment framework. The test of good reform is not how it works for the average participant, but how it works for those who are most vulnerable around the fringes. For example, a person with intellectual disability unable to stay at home with their ageing parents, such a circumstance requires careful human judgment and flexibility. Automation improves efficiency, which is great, but human oversight is a critical safeguard we can't miss. My third point is that quality services costs money to deliver. A sustainable market of quality providers is not an end in itself, but it is the mechanism through which participants receive safe and high-quality supports. Quality providers will invest in workforce capability and risk management frameworks and structures, etc., but all of this comes at a real cost. My final point here is that reforms should provide certainty and safeguards for participants and their families. The proposed decision-making arrangements warrant careful consideration because of their potential for unintended consequences. Decisions that remove or halve an entire support category may be administratively efficient, but it can have profound impacts on safety, independence and family sustainability. The community needs confidence that significant decisions will be transparent, evidence-based and subject to appropriate safeguards and opportunity for review, importantly. We believe that these reforms present an important opportunity to strengthen the NDIS. Our recommendations are intended to help protect both the scheme and its participants for future generations to come. Thank you, Chair.
Thank you. Is there anything you wish to add, Mr Butler?
Nothing to add from me, thank you.
Excellent. We'll go to questions. Senator Steele-John.
Thank you, Chair. Thanks very much. Now, you'll be very aware that it's quite common for NDIS participants who don't have significant funding for supports to end up in hospital, sometimes for literally months at a time. The bill, as it is currently written, will cut supports for participants and result in some 241,000 participants losing access to the scheme altogether. Do hospitals have the capacity to manage to surge in attendance that could result from this many participants losing support?
I think that's a good question, Senator, and I think particularly from a public hospital perspective, we know that there's a lot of capacity constraints at the moment. And we have to remember, as you rightly point out, that the NDIS doesn't operate in isolation, and there's a danger at a system level that participants can fall through the gaps and between programs as well. And CHA has done a lot of work recently on issues such as delayed discharge. We know this is such a pressing issue in the hospital sector across Australia. And that's where someone may be clinically ready to leave hospital but unable to do so because the disability supports there aren't available yet. That's why we think it's so important that no one is transitioned off the scheme before those alternative supports are in place, they're ready and they're accessible as well.
Yeah. It's correct, isn't it, that the legislation as is currently written does not include any such guarantee that participants will only be removed once alternatives are in place. That's correct, isn't it?
I believe so, yes.
Yeah. Could the increase in demand for hospital services result in longer wait times, in your view?
Quite possibly, yes. And going back to the point around delayed discharge, that is a pressing issue right now in Australia, and it's something that we need to be cognizant of whilst going through these reforms.
Yeah. Have you raised concerns about these potential flow-through impacts with the government, and if so, what was the response you received?
So we recently hosted a roundtable on delayed discharge, and it included representatives from across disability, from health, aged care, and different sectors. And this was the sort of flow-through point is a broader discussion that we've had, and I'm very much aware that it's on the government's agenda as well.
Ms. Cattermole, you said in your opening statement that while there are some elements of the overall, I think you phrased it as a purpose or goal of the legislation that Catholic Health Australia could support, that sequencing and transition was critical to that. Is that fair summation of what you shared with us?
Yeah, that's a fair summation. We support the intent of the legislation and the need for a reform. Absolutely, there's a need for reform to protect the viability and to safeguard participants, so we support that. I suppose the comment here is to make sure that we enable a sustainable market of quality providers, and the concern that the complexity and volume of current reform, when they all happen together, it draws resources away from service delivery, which places unintended consequence or risk on participants, either as a result of providers who are unable to lean in and deliver those services, or perhaps families who are needing to provide the supports as primary carers. The unmet need does not go away. It has to go somewhere.
And in terms of the patients within the systems that you manage, do you see a lot of patients within your systems that are NDIS participants but that have ended up in hospital due to currently to a failure to receive the supports that they needed?
St John have got a CORD. We are a division, the disability provider division of a very large organisation, St John have got healthcare. And within a CORD, we provide support, disability supports, to approximately 1,000 participants on the NDIS scheme. And what we are seeing is that when there is changes in participants' NDIS plans, there is a direct impact and a flow-on effect either into other sectors and other streams. So, for example, the risk of a reliance on healthcare or on families.
Yeah, thank you. It's come as quite a clear message to the committee that there is broad concern in relation to this legislation and the impact that it may have on people. The Australian Catholic Bishops' Conference issued a statement in relation to the legislation about a month ago, I believe, flagging a number of concerns, including the automated decision making provisions, and cited the Pope's encyclical on the matter of artificial intelligence and automated decision making. We've heard from a number of experts, disabled people, allied health experts, academics, speaking more or less with one voice, telling us in the current form the legislation shouldn't pass. You've spoken about the need for sequencing and transition. One of the most significant parts of this legislation in terms of people's flow-through need for healthcare is the removal of 50% of people's funding for social and community participation, as well as a across-the-board 10% cut to therapies. That's all going to take place in around 12 months' time post the passage of the legislation. In this context, do you believe that the bill in its current form should pass?
So we definitely support a version of this bill passing, but not as currently drafted. And I think from the moment when we wrote the submission, there's been some positive inroads in certain areas, but we would like to see further safeguards and oversight brought into the bill. And again, as Rebecca's already mentioned, we support the general direction of reform, and we agree that the NDIS should be put on a more sustainable footing. But I think the bill, as we currently read it, it gives legislative effect to, whilst it gives a legislative effect to many of the recommendations of the 2023 review, we would like to see further opportunities for, say, participant-level avenues of review. We believe that there's certain opportunities for parliamentary disallowance over delegated legislation, and there's opportunities for further oversight and scrutiny.
And the elements of the bill that say enable a minister here in Canberra to unilaterally cut by 50% the support hours that somebody with Down syndrome might rely on to do their grocery shopping, or that a blind Australian, as we heard yesterday, might require to be able to do something as simple as go to the gym or attend university. Would you oppose those elements of the bill as well?
So we recognise that delegated legislation, such as the instruments you're describing, are sometimes appropriate mechanisms for implementing changes to such a complex scheme as the NDIS. But our concern is that the bill confers certain powers that may affect participant rights, as you describe, and they might also impact provider obligations and border scheme administration. So we recommend that pricing determinations and their pricing documents, the transitional rules and key instruments governing everything from the transition to automated decision-making and the Section 34A instruments that you're describing, these should be open to, at a participant level, some sort of recourse, whether that be for the ART or a merits review stream. For certain powers as well, as we said, we'd like to see parliamentary disallowance, particularly around the pricing determinations in Section 45C.
It would make more sense to you, I would imagine, as an organisation, if pricing was handled by an entity like IHACPA.
Yes, correct. And that was one of our recommendations. That's something we recognised from the 2023 review as well. I think they identified that the NDIA has this dual purpose of both the payer for supports, but also the body that advises the minister on pricing. So we'd like to see that transferred potentially to IHACPA. We think a body with decades of experience in actuarial and price modelling, that would be quite a sensible move.
Yeah, thank you.
May I add a provider perspective also? We absolutely support a sustainable NDIS, which means that there are efficiency measures that needs to be found. But the provider perspective here on an operational day-to-day, what we see in our day-to-day services is the importantly, we have to make sure that there's no unintended consequences. So, for example, you mentioned, Senator Steele-John, the potential reduction or the planned reduction for the community participation funding. For some participants, that is really problematic. I'm going to give you two brief examples. In a supported independent living setting, a SIL setting, which is a shared group home, a reduction of community participation funding could potentially risk transferring the responsibility to the SIL, the home provider, or the provider of the supports in that home, which would not be funded. And that risks potential tenancy viability concerns and risks in that space. And it also places pressure on the quality providers who are wanting to continue having that continuation of support obligation under our legislation. The other example I will give briefly is a person with a disability living at home with family members, and the family may be relying on community participation funding so that parents can continue working and be productive members of society. And another unintended consequence here, if community participation funding is halved, is that it may put pressure on families who may no longer be able to continue working in their current capacity. So these are the things that we just need to be really mindful of, but still supporting the general need for a sustainable NDIS.
Yes, I understand. Given that you are a SIL, and this will be my last question, Chair, given you are a SIL provider and you've just shared that with us, you've talked about the risks that could pose to the overall environment within a group home dynamic. Can you step those out for us a bit more? What could it practically mean if people aren't able to leave, if they basically have their ability to go outside their front door from that setting, cut in half? What could it mean for the person, but also for any workers working with them?
Yeah. As quality providers are really keen on supporting the fundamental rights of people with disability to live lives of dignity and have their human rights supported, the right to have voice and choice and control over their lives, just like any other member of society. And the potential unintended consequences, if not looked at carefully, is that reduction of funding may mean that people are unable to access their community and visit families and enjoy those human rights like the rest of the community.
Thank you. Thank you very much. Thanks, Chair.